Imagine being homeless with children. Tragically, this is reality for thousands of families. Over 47,000 men, women, and children are homeless in Los Angeles County on any given night. The Midnight Mission's Homelight Family Living Program has been providing a safe place for homeless families in crisis since it opened in 1994. Homelight's 11 apartment units are fully furnished with everything a family may need as they recover from the trauma of domestic violence, human trafficking, addiction, and other unthinkable circumstances. In the safe and secure environment we provide, families can work through their pain, gain employment, save money, and rebuild their lives.
You know, when you come into Homelight, you actually know there's people here who care about your well-being. And so that's like a relief. If you're not just another check or another number, you're an actual person, an actual family.
And I remember walking into that door and they're telling me, this is going to be your place. We thought we were going to have to share. No, this is going to be your place.
Homelight Family Living offers job training and placement, education and tutoring, counseling, child care assistance, life skills classes, as well as social and recreational activities to break the cycle of abuse and poverty and create a foundation for independent, successful living.
It taught me to save money. It taught me how to budget. I mean, I've learned so much from being here that I still carry with me and probably will for the rest of my life.
Very thankful, and especially to give me back my family that I thought I was gonna have to give up.
All the women, we all participate. So we're all united in this group.
Homelight Family Living needs your help to continue providing hope to those who need it more now than ever. Please get involved today. Visit midnightmission.org or text STOP-DV to 41444 to give. This is the day to change a life.
Hi, everybody. I'm Mike Arnold, President and CEO of the Midnight Mission, coming to you from the epicenter of homelessness in America, Skid Row, Los Angeles, California. Today, I want to talk a little bit about homelessness, COVID-19 in the city of Los Angeles, because I think we have unique problems, unique scale, and maybe not so unique a political environment that makes it extremely challenging from a variety of different fronts. But I want to share with you how we got going, what happened, what we experienced, and hopefully we'll leave on a good note and our experiences here can help all of you going forward. So let me talk a little bit about me. My background is I was in public accounting, worked for large firms, the Big 8, now the Big 4, for a long time before I went into private industry, worked for nonprofits, universities, academic medical centers, hospitals, and research institutes providing strategic, financial, and general management services. I was also a CFO, a COO, and a CEO. So I got a lot of experience before I got involved as a consultant with the Los Angeles Homeless Services Authority here in Los Angeles. And it opened my eyes. It helped me to understand how complicated, how complex, and how challenging homelessness is as a problem to try and solve virtually anywhere in the United States, not to mention a large, sprawling, bureaucratic place like Los Angeles. So that's a little bit about me. I'm going to share my screen, and we are going to talk a little bit about my organization, and then we're going to go on a little tour. So again, my talk today, Homelessness, COVID in Los Angeles, a provider's perspective. I want to share a little bit about my organization, and I'll let someone, a good friend of our organizations, do that for me.
Hello, I'm Tim Allen, and this is the Midnight Mission, an organization that for 100 years has led the way in helping people change their lives. Tom Littlecote, father of the poor, opened the doors of the Midnight Mission in 1914. It was a refuge for the men of Skid Row. Today, it continues its tradition by providing food, clothing, and shelter to the homeless community of Los Angeles. The Midnight Mission and its volunteers not only help support the community, but also offers a way out of poverty, drug addiction, and alcohol dependency by creating a path back to a life of self-sufficiency. The Midnight Mission operates without reliance on government funding, providing all their needed services with private donations. It offers a compassionate bridge to productive lives by providing job training, education, work programs, and most of all, family housing for the neediest among us, the women and children of LA. This is the day to write down the number and website address on your screen and do your part to make life better for our neighbors. Thanks.
So just a quick little editorial. So that was created back in 2014 for our 100th year anniversary. And since that date, we have actually built very strong public-private partnerships on public funding for particularly crisis and bridge shelter beds. And it's allowed us to expand our capacity to serve more people. And it also has allowed us to really create a public-private partnership that creates a really rich service environment for people who are in our programs. As most of you know, emergency shelter and bridge housing funding doesn't support things like a school, a teacher, a computer academy, career counseling and training, job work, search, and so on. And our public-private partnership allows us to use our philanthropy to do all the things that government won't pay for, and provide people with an incredibly rich program to get their lives back together. So I'm Mike Arnold, and I approve that message. Ha, just kidding. We're all sick of that, right? So let's talk a little bit about the scope and the scale. The scope of homelessness in Los Angeles is mind-boggling. So with the results of the 2020 Los Angeles County homeless count, we had 66,436. And you know, I know for an estimate, it looks pretty precise. You know, if you're an accountant, you kind of joke about that. The reality is that Los Angeles takes homeless counting extremely seriously. And every year, a count is overseen by the Los Angeles Homeless Services Authority. And anywhere between 7,500 and 8,500 volunteers go out and literally canvass every census tract in Los Angeles County. It is a visual enumeration consistent with HUD guidelines, but that means you've got to be out there to see it. So we do a great job here. Kudos to the Los Angeles Homeless Services Authority and the hard work that goes into that. And it's a huge, huge number. Just to put it into perspective, if we look at Dodger Stadium, you woohoo, Dodgers, World Series leaders, or World Series winners, had to throw that in there. But anyway, Dodger Stadium, 56,000 people fit in it. We would have another 10,500 people standing in the field of the stadium after filling it with the number of people experiencing homelessness. To put it into perspective for you guys up in Oregon, we could take Springfield, and if we added 4,000 more people, we would have our homeless count. Corvallis plus 5,000. Tigard plus 10,000 and Albany plus 11,000. In fact, the Los Angeles homeless population would be the 9th largest city in the state of Oregon. How's that for perspective? So with large numbers comes big problems. Needless to say, we have concentrations that are not seen anywhere else in the country. Now, I'm sure some of you have areas where you've got a little bit of space where your sidewalks might look like this, and it might look like this for a short period of time. Here in Los Angeles, we have large swaths of ground that look like this for a long time. So we've got a problem that is becoming increasingly visible, and along with the visibility, the good news is that it's getting attention. Homelessness here in Los Angeles City and County is the #1 item that the residents of the county and the city want addressed. So there's tremendous pressure on our policymakers to do something, and people are willing to put their pocketbook where their mouth is. We've had 2 ballot initiatives that have brought significant funding to trying to solve the problem of homelessness. Now, the best way to sort of see what goes on here is to take you on a little drive around the block. So I'm going to take you on a drive in my neighborhood. If I can get this to work, there we go. So I'm pulling up to the Midnight Mission. We're actually on the other side of the street, but this is what Skid Row looks like on a typical morning. You'll see the tents, you'll see people packed up, lined up in front of service providers. But I think the important thing is to see just the concentration and how close people are to each other, living to each other here on these streets. I'm going to give you some, before I forget, the good news that you'll see in some of this is that there is a lot of permanent supportive housing in the community. There's lots of permanent supportive housing being built in the community, but we are so far behind in those resources that while it's good news, it's not good enough. We still are going to have a huge problem for a long period of time until we can get housing to scale. So I'm going to give you some statistics on homelessness, sort of homelessness at a glance, while you take a look at this community we call Skid Row. And I should point out that this is kind of Skid Row light, because a lot of the folks, this is the first 15 days of the month. This was filmed on the 7th. And what you see, and you probably see it in your neighborhood, is that when people get their welfare checks, they get their Social Security checks, they get their pension checks, while not enough to afford a place to live, it does afford people a chance to get off the streets for a couple of days. So the tents will go down, it'll lighten up a little bit, and then they'll come back once their money runs out in 7, 10, 12 days. So homelessness at a glance in Los Angeles. So our homeless count increased 12.7% overall from 2019 to 2020. We went from 58.9 to 66.4 thousand people. Family homelessness arose an astounding 45.7% from 8.8 thousand family members to 12.8 thousand family members. Youth not wanting to be left out rose 19% from 2019 to 2020, from 3.9 thousand youth on our streets to 4.7 thousand youth on our streets. And as you all know, youth are particularly difficult to count because they are very, very good at hiding. They also have different hours than you typically would have with an adult population. But what is probably most astounding and most alarming is that our chronic homeless population rose 54%. It rose from 16,528 people to 25,460 people. So literally 1 out of every 3 people experiencing homelessness in Los Angeles is now chronic. And as you all know, when people become chronically homeless, they become incredibly difficult to house, to service, and to keep housed. They become our most expensive solution. What you're seeing in Skid Row, and I mean, look at these streets. I mean, this is a major east-west thoroughfare there that is just lined with tents. I fondly refer to our tents as Los Angeles affordable housing, because it's about the only thing that folks on low income can afford. Sad but true. But what you're looking at is an historical policy on containment. LA City and County many years ago decided that the best way to deal with homelessness was to create a little section in a industrial area, set up services. It was around where the missions were, so there'd be shelter beds, and then everybody in the county was dropped off in Skid Row. And we all know what happens when you sever connections. So it's a failed policy, and it's incredibly difficult to ever undo this terrible policy. It's also the sign of decades of ignoring the problem and underfunding solutions. When I started at LAHSA, it had an annual budget of about $70 million for roughly the same amount of homeless people as New York had, with a $1.5 billion budget. It's also, I think, these current numbers are a sign of the shiny new thing syndrome, where we chase quick fixes. And what I really mean by that is we lost focus on every component a continuum needs to make sure that people, wherever they are in that continuum, are able to access services. because we focused. And I think we're like many of you, and that there's nothing wrong with a focus, but it has to be balanced on permanent supportive housing. And in doing so, I think the unintended consequences is that services that could help people quickly get back on their feet and back into housing were cut back or not funded. And those people were allowed to become damaged and develop into chronically homeless over time, which just accelerates the cost and accelerates the magnitude of problems of getting out of it. So that's kind of my soapbox aspect of this, but I think it really does point out we need to make sure that our approach to homelessness is balanced. We need to make sure that our approach to housing is balanced. And since this is a housing conference, I do need to say that the other thing that that little tour just showed you is how unhealthy a neighborhood is when you concentrate poverty. Now, this should be nothing new to any of us. But having said that, building housing, building healthy neighborhoods means we have mixed income housing everywhere. We should not concentrate poverty because you end up with a situation like we have here in Los Angeles. So I encourage all of you, if you're working with your cities, your counties, your states on developing housing policy, really focus on mixed income, mixed use properties and housing opportunities so that we build healthy neighborhoods throughout our respective cities. So where were we back in February when all of this sort of started rolling toward us? So as I mentioned, Skid Row is high concentration. We've got at least 4 rescue missions. These are organizations that we know of, and they pop up and pop down quite a bit. We all have congregate living programs, which is cause for particular alarm when you're talking about respiratory virus. We've got a multitude of other providers here that include social service, mental health, physical health, permanent supportive housing, and a lot of single room occupancy hotels that have been converted to permanent housing that have shared bathrooms, shared community rooms, and shared kitchens. So just a lot of exposure relative to contagion when you're dealing with a respiratory virus. In addition to that, we've got around 3,500 people who are living on the streets, and you saw the compression. And when you have people living that close who are particularly vulnerable, you get very concerned. Many of us also have large feeding programs where people come inside, they sit elbow to elbow in large dining rooms and eat. We serve over 1 million meals a year here at the Midnight Mission for our residents and for the community at large. And that includes low-income folks, it includes seniors, it includes a lot of the folks you saw on the street that come to us to eat in these kinds of spaces. As you also noticed, there's limited hygiene capacity. Now, you may have noticed there's some porta potties, there's some portable stations. All those came after this became a big issue, and I'll talk about the real catalyst for that when we get toward the ending. But there's just a lack of hygiene facilities overall, and in fact, the Midnight Mission was the only facility that provided 24-hour access to bathrooms, including showers, 24/7 here in Skid Row up until July 1st of this year, 2020. The other issue that we have affecting us is this concept of community involvement. With this kind of concentration, people are always coming down and they're unloading van loads of food items, clothing, and oftentimes a lot of that just ends up being left on the streets. One thing we can say about Skid Row, no one goes hungry. So when people come down here, there are lots of places in LA County that have food insecurity. Skid Row is not one of them. But oftentimes people will come down, good hearts, good intentions, but it ends up contributing to the health hazard that Skid Row has become. Now, when COVID started rearing its head and we were all watching with some degree of anxiety as COVID was being identified in Italy, we started seeing New York experience cases. It sort of felt like, to me, we were watching a slow motion train wreck. We did not see a lot of activity at the federal level, at the state level, at the local level. We just did not see a response. And then when the responses started coming, they seemed kind of uneven. There was contradictory messages that was going on. And I think that all points to just we were not prepared at all levels. I mean, just not prepared. And I hope a big lesson that comes out of this horrible, horrible time that we're living through is we need to all be prepared and take it from the macro level at the federal level to the micro level here within our own individual organizations. We all know enough to prepare for something like an earthquake. But having said that, none of us at any level was prepared for what has hit us and caused this amount of chaos and turmoil. So there was a lack of personal protective equipment. There was inconsistent messaging. And we didn't know really who was doing what. There was confusion over who was doing what and how it was getting done. And there was really slow adoption of any kind of public safety measures. So it was chaotic and it was disorganized and there was not a consistent message. We sort of got here in Skid Row, we have a providers collaborative that shares information, and we had a new CEO that was just selected for one of our agencies, Amy Turk. She's the new CEO at the Downtown Women's Center, a wonderful organization that has focused on homelessness and women for a long time. And she sent out a memo that she was sending out to her staff that talked about, if we go into a lockdown, here's what to expect. And it was a huge wake-up call for all of us because it talked about not being able to drive. It talked about being locked down in our facility. It talked about things that frankly, I hadn't considered. And it just rolled over you like a cold wave. But it was that catalyst that I think accelerated all of us to do the old proverbial OMG moment. We need to wake up. And we all kicked into motion. Now, the unfortunate thing is we all kind of had to kick into motion in our own organizations and figure out what was going on. But here are the things that we did, and I think they really helped us. And I'll talk about our outcomes in a minute. So the first thing that we did here, and this may be because I've got a healthcare background, I understand infection control. We immediately set up a daily meeting. We call it the wellness team. We meet every morning. We still do. We started this back in March. We still meet every morning and we say thing we know about COVID and about risk that we see in our organizations and use it as a tool to roll out policies, to develop policies, to talk through issues. And it's been incredibly valuable for my team and myself to get organized. So first thing we did is we started on the ground floor of our building and said, all right, so we have a viral agent out there. It appears to be respiratory. How is it going to get in? How is it going to infect people in our organization, be they participants, be they staff? So we rolled out strong, literally clinical infection control mechanisms. The janitorial staff was beefed up and they started disinfecting hard surfaces every 2 hours, whether it needed it or not. We started people wearing masks early on. We closed down a huge volunteer program. We have a volunteer program where about 18,000 volunteer encounters happen here every day. And again, it was part of our meal service program. And a lot of the kitchen work was done by volunteers who'd come in and spend breakfast, lunch, or dinner and help us both prepare and serve food. All of that got shut down. We immediately transitioned our indoor feeding program to an outdoor to-go program. We literally adopted healthcare standards for infection control. We identified all workers who could work off-site and from home. We equipped them and we sent them home to work. And again, our philosophy was if COVID comes to our facility, it's probably not going to come from the people we serve. It's going to come from people who are coming from somewhere. Certainly none of our folks had been to the Swiss Alps skiing or to Italy or to any of these hot spots in the near term. So we knew that the goal was to keep it out. So we focus all of our activities around creating a safe and sane and sanitary environment and also restricting internal access. Visitors could not come visit anymore. Anybody who was an outside worker had to come in and be screened. We restricted access out of the facility for essential needs, which meant that we created all of these residential enrichment programs for the folks that were stuck in the building. We turned our gymnasium into a movie theater. We got a big popcorn popper, and from about 1 o'clock in the afternoon till 5 o'clock at night, it is a movie theater that's designed to show as many movies and keep people as occupied as we can, to keep them in the facility and not out, potentially exposing themselves and then bringing it back to our organization. As most of you have done, we've instituted daily health checks. We were an early adapter of masks, and we put up a lot of signage, education, videos on infection control, washing your hands, covering your mouth, and we enforce it. And I think that's really the key thing. I mean, I think a lot of organizations put up rules, but they're not very good at enforcing it. We have a zero tolerance policy, and people know when they see me coming down the hall that they better not have their masks off. And it's very, very seldom that I do have a conversation about the importance of keeping your mask up. The other thing, we were very fortunate. We've got a robust gift in kind program. So we had a lot of personal protective equipment on hand. We had N95 masks that were donated. We had gallons and gallons and gallons of hand sanitizers that had been donated. I had a warehouse half full of toilet paper. So the things that were critical issues elsewhere weren't really critical issues for us. And in fact, we became a supplier for a number of PPE items to street outreach workers and our collaborators in the community, because they just didn't have it in sight. So all of those were things that we were just lucky. We didn't plan for it, but we were just lucky. We also changed our intake protocol so that we could isolate people before they come in the building, put them into a isolation quarantine for a period of time until we could verify that they weren't infected before we would put them in our congregate care beds. And we've got 3 dormitories, one of 49 beds, one of 150 beds, and one of 91 beds. And we configured any sleeping in those dormitories to ensure that there was at least 6 feet distancing, and reduce whatever occupancy we needed to reduce to make sure that we supported that distancing. So while we were looking at how we create a safe environment, we were also looking at how we could reduce risk with specific clients. Because we know, dealing with a homeless population, we are dealing with people who have a variety of conditions that make them potentially more susceptible to a serious, if not fatal outcome if infected. So we started going through HMIS and sitting down with our case managers to identify anyone who seemed to have risk factors that would make them susceptible to a serious or fatal outcome if they got the disease. And we actually started isolating internally. We had some available rooms that we turned into bedrooms. And when we identified people who had particularly vulnerable conditions, we moved them into those rooms. Now, they weren't ideal, obviously, but we did recognize that if it did get in, we wanted to make sure that its impact on our residents was minimized, especially to those who were most vulnerable. So we implemented a protective isolation policy from within. And then we reached out and worked with our medical provider in public health to see if we couldn't get testing on a more frequent basis. And I think we all struggled with this notion of testing policy based on supply. Crazy. We nationally were unprepared. As a result, there weren't enough tests out there. And as a result, the testing messaging was based on the supply of tests, not on best practices relative to infection control and disease management. But we were pushing at public health and at our healthcare provider. We have an on-site clinic that provides on-site healthcare and mental health as well as dental health. So we were pushing on that because we thought we needed to get everybody, including staff, tested every 14 days. And I have to be honest, our public health and others in the community, like most jurisdictions that you guys are coming from, we're just not prepared for the scale or scope. And as I mentioned, our scale and scope here is jaw-dropping to begin with. What we saw from a provider perspective looking out is they were really hobbled by the lack of adequate PPE. So things didn't happen very quickly because they were very concerned about protecting their staff and employees. At a point in time in which we needed people on the streets, we needed people out there doing tests, we needed people screening for symptoms, and it was really challenging because they didn't have the equipment that they needed to do that. We also struggled again with that testing capacity, and as you all know, unless you had a symptom, you couldn't get tested for a while, and that's just nuts. We know that now, but it was supply-based policy, and hopefully we will have learned from that going forward. Our city and our county really didn't have that much of an infrastructure to support a pandemic of this magnitude either. They had to build up quickly. People got diverted off of one thing and had to do other things. We actually didn't see a lot of contact tracing. What I can report to you is that we were very, very fortunate. We've had 2 clients in our residential programs that tested positive, but we identified it early and they were isolated early so that there was no spread within our facility. And we had 3 staff members who contracted it outside of work, but our screening protocols caught them soon enough so that there was, again, it was caught before it came to the facility. So we are incredibly lucky. Our colleagues in the community have not been nearly so lucky. We've had one provider that has had over 150 case outbreak that included deaths within the facility. Another one has had several reasonably large outbreaks. And again, when you are in a congregate facility, you are particularly susceptible. So it's really critical. And if you run SROs, if you build SROs that have community space, that have shared bathrooms, implementing and encouraging compliance with safety protocols is absolutely critical. And then obviously, there really wasn't a very clear coordinated approach to testing equipment. And as agencies serving a particularly vulnerable population, it seemed to take a long time for our support agencies to get their act together and provide much guidance. The good news is we were pretty much ahead. I didn't suffer. I don't feel like our organization suffered much, but we had skills here that I think many organizations didn't. So, but I suspect that was not very different from what you saw within your own jurisdictions as it relates to this. How we're organized here in the Los Angeles City and County is the county is typically responsible for doing a lot of the service stuff. When it comes to homelessness, county does service theoretically, the city does housing theoretically. So the city doesn't have much services that relate to things like mental health, public health, community health, healthcare, and had to really rely on the county, and the county wasn't very prepared. So the city, to its credit, did step up and implement its own strategies. They went out and tried to procure and distribute PPE. So the city, I think we got somewhere in the neighborhood of 10,000 masks that we then used to distribute to the folks that we were serving and handing out meals to try to get folks on the street to mask up. They also rallied the fire department. So one of the things that I really applaud our city for doing is they created mobile free testing sites with the fire department, so that these mobile testing sites are kind of pop-up sites. They appear throughout Skid Row and encourage people who are living on the streets to get tested. And the testing is free. And frankly, the results that come back from the fire department testing is pretty darn quick. We get results back, although initially it took 3 or 4 days. We're now at a point where if you get tested today, you'll have your result back by lunch tomorrow. So there are some really good things that I think have happened in terms of response rates that did involve various jurisdictions that didn't have a lot of responsibility to do it. If you look at how they've traditionally been organized, that really have stepped up. The other thing that the city did, although this was compelled to do by the court system was put out porta potties and sanitation stations where hand sanitizer and hand washing capacity was available literally throughout the county, throughout the city, wherever there was a encampment, which is pretty much everywhere at this point in time. So a lot of, you saw in the drive around Skid Row, a number of porta potties, a couple of hygiene stations, and that was really an impetus from the court system. But I think the biggest observation is the lack and undersupply of testing continues to impact our ability to have quick access to, quickly identify, and quickly protect our organization from folks who may be walking around with COVID. The other thing that I think is really significant to talk about is funding. So as part of the federal actions, a lot of money came to jurisdictions to address vulnerable populations. And LAHSA, who is the continuum lead, used that funding to create a program called Project Roomkey. And the goal of Project Roomkey was consistent with what we were doing, which is identify people who are most likely to have a severe or adverse outcome if they contract COVID, and get them into some form of protective isolation, get them to a safe space. And since nobody was staying in hotels, we all thought, gosh, it should be easy. We'll go rent 15,000 hotel rooms and we'll get people off the streets and into these hotel rooms so that they can be safe. Well, we achieved about 4,300 rooms that got rented. And I know Amy Perkins is talking to you all, and I think she'll share with you some of the challenges that LAHSA ran into. They are things that we see every day, not in my hotel, not in my hotel room kind of mentality that got in the way. But those 4,300 rooms did have about 6,000 people that came off the streets or out of congregate environments that were less safe, and got them into a more safe environment. One of the things we struggled with that process was that originally the most vulnerable criteria also had an age criteria. Now, we had people who were below the age criteria who were undergoing cancer treatments and were immune system comprised. We had folks suffering from AIDS who had no immune system and were compromised. We had younger folks who had severe asthma, as well as emphysema, and none of them were considered vulnerable. So we worked with our policymakers to expand that criteria so that we could have a broader segment that would be eligible for a safer space while we learned more about this disease and dealt with particularly dangerous environments in congregate facilities. The other thing that was obvious is we're a big city, we're a big bureaucracy, so things rolled out slow. It was slow to get the rooms. It was slow to get people into the rooms, and it was slow to get services to the rooms. And the service aspect, I think, is particularly challenging because as an agency, if we got someone into Project Roomkey, we had to continue to provide remote case management for that individual. So we turned into a lot of our case managers into telephone case managers so that we could give people the touches and the counseling and the coaching that they needed to stay safe and stay isolated. Where we found it most difficult, and for those of you who provide substance use disorder services, this was incredibly challenging to keep people who were new to sobriety sober when they were isolated offsite and didn't have that human contact, that personal touch that is so important when people are learning how to master tools of sobriety. So it was particularly challenging. And I think if there's something to learn about this kind of a concept is that we need to recognize, we say we do, we don't always implement that way, but different segments of our population have very, very different needs, and we need to be sensitive to those needs. And obviously the obvious one, which is there's far more need, as you saw from our streets, than we had capacity, and we continue to have that. So now Project Roomkey, as that funding sunsets, is morphed into Project Homekey. And the goal of Project Homekey is to make sure everybody who was part of Project Roomkey, including Roomkey eligible, i.e. those folks we all identified as particularly vulnerable to an adverse outcome under COVID, but didn't have a room for them to go into room key, could be eligible for being triaged quickly into alternative permanent housing, which is a great goal. But we then bump up against that, 30-foot, 5-foot wide wall called insufficient housing, insufficient housing stock. So now we've got again, to some extent, I think this might be the shiny new object issue, where now we've got people in Project Room Key, and we've made the commitment that we're not going to send them back to a shelter or interim housing. We're going to get them into permanent housing in an environment where we don't have a lot of housing. So we've got our coordinated entry system, which has been working with chronically homeless, including vulnerable people who've been waiting for a long time for their ticket to get to the top of the heap so they can get into permanent supportive housing, being displaced by the Project Home Key program. So it's confusing. We're not quite sure how it all works. And it seems like our priorities are changing, based on, once again, the direction the wind is blowing. And we don't seem to stay focused on the long run versus the short run. But there's lots of pressures out there. I know I've been in that situation. So we'll navigate our way through it. But I do have to say that from a provider perspective, there is a lot of confusion about where people who are currently in the queue for permanent supportive housing are falling, where people who didn't get into Project Room Key but were Project Room Key eligible are falling, and specifically how we're going to find all of these housing opportunities for people that we know to be particularly vulnerable. So bottom line, there's a lot going on, and it will unfold, I guess, as it unfolds. So I want to overlay over this complex environment yet another dynamic, and that is the court systems. And it seems like Los Angeles is never in a situation where either the county or the city isn't in one court case or another dealing with homelessness. They're currently in one that is actually having a fairly significant impact. It was actually a group of the business community got together and said, look, the city and the county are not doing enough to deal with people experiencing homelessness, and they sued them. And they were lucky enough to get a judge who happens to have a particular interest in homelessness. Judge David Carter, he dealt with a similar lawsuit in Orange County, and he basically strong-armed the cities and county of Orange to add probably 150 to 200% more interim housing beds than they had planned on doing, and he did that in like 4 months. So he just came off of that case, and he's trying to do the same thing here in Los Angeles. But what he is finding is that dealing with 5,000 people experiencing homelessness is very different than dealing with 67,000 people experiencing homelessness. And then you've got two 800-pound gorillas. You've got the county of Los Angeles and you've got the city of Los Angeles. And they have historically challenged collaborative working relationships. That's about as politically correct as I can get. They used to hate each other. Now they don't hate each other, but they don't exactly go out to dinner together, if you know what I mean. So it makes any kind of agreement incredibly complex. The shortfalls in general funds at both the city and the county level that have been a part of the impact of COVID on our communities, it is also driving them to take positions that are not terribly attractive to the judge as he pushes. And then the other thing that I think is an overlay is that the court is now placing requirements on the city and the county that are contrary to both the coordinated entry system perspectives on housing as well as Project Home Key's perspective on housing. He's basically demanding that the city and the county find housing, shelter, or any kind of housing, but either create it or find it for anyone who is living under or near an overpass. his perspective on it seems to be that they're in particular danger. They're inhaling fumes. They're around motor vehicles. They're at risk. We need to take care of them. So there's all of these moving parts that creates a complicated, complex, and extremely challenging environment. So we will keep you informed as that moves forward. And as the judge said about the agreement, and I'll paraphrase, he said, working with the city and county of Los Angeles is like watching two billionaires having lunch at McDonald's, arguing over who was going to pay for the burgers, while the parking lot was full of starving people experiencing homelessness. So if he says that, that gives you an indication as to what the rest of us deal with a lot of the time. But there's a lot of good things going on in Los Angeles. There's a lot more money. I don't have time to talk about it. There's a big focus on housing, but also to add to the conversation about scale and the degree to which we struggle. We project that we need over 525,000 units of affordable housing now. 525,000 units of low-income and affordable housing, and that includes permanent supportive housing. So we've got a huge need. We need housing. We need better models for housing. We need lower construction costs for housing. But at the end of the day, our biggest and single most challenging obstacle to get over is we just do not have housing that people can afford and be sustainable in, who are coming off our streets. So anyway, I'm sure you all have similar kinds of problems. Wish you the very, very best. Stay safe, wear your mask, and hopefully we will be able to see each other in person next year. Thanks a lot. Have a great one.